Okay, good morning everyone. Thank you all for joining us and welcome to this event as part of Adoption Week Scotland 2020. For those of you who've joined us for other events this week, welcome back. It's nice to see you again. And for those of you who are joining us for the first time, it's lovely to have you. So this morning's event is our ministerial question and answer session, and we are delighted to be joined by not only one but two Scottish Government ministers. So I'd very much like to welcome the Minister of Children and Young People, Ms Maree Todd, who some of you may recognise from having attended previous Adoption Week Scotland events. And we're delighted to have her colleague, Mr Joe Fitzpatrick, the Minister of Public Health, here with us too. And he's going to be sharing his knowledge about how his remit of public health can better support adoptive families. Over the last few weeks, we've been collecting and collating questions that have been sent in from a variety of different people. We've had questions from adopters, from prospective adopters, professionals, adopted individuals, and importantly, some adopted young people themselves. And we are really happy to be joined this morning by one of those adopted young people who is going to be asking some questions directly to the ministers. But I'm very pleased now to hand over to Eleanor Bradford, who is not only an adoptive mum of two, but also one of Adoption UK's trustees, and crucially has experience being in a former life a BBC journalist, and therefore has much better credentials than me to be running this question and answer session. So without further ado, I'd like to hand over to Eleanor and the ministers, and thank you. I'm looking forward to hearing the discussion, as I'm sure as everyone else.
Thanks very much, Fiona, and hello everyone. I hope you're nice and cosy at home. It's absolutely pouring it down up here in Maree. We're going to crack on. We've got about 45 minutes. I've grouped everyone's questions into three broad themes: one about education, one about fetal alcohol spectrum disorder, which I know is something that Scotland's really been forging ahead on, and then another group which is just about general questions. So if you submitted a question, please stick with it because it may come up later in the webinar. So first of all, let's kick off. First question: when a child is adopted, their problems do not disappear, but their rights to support do. They lose their entitlement to additional support. Why can't we protect these rights in education, ministers?
Hi there. I think I'll kick off on this one. Firstly, I want to say thank you so much for having me along today. It's a real pleasure to spend time with so many of you and to answer your questions directly. When a child's adopted, they don't lose their entitlement to support. And one thing I want to emphasise is that all children and young people should get the support that they need in school to reach their full potential. The legislation is very clear that education authorities have legal duties to identify and provide for and review any additional support that children and young people need to overcome any barriers that they have to their learning. When we launched the Care Experienced Children and Young People Fund in 2018, we made a very, very deliberate choice to use the term care experienced to ensure that anyone who has been or is currently in care would be eligible to benefit from the fund. So that includes adopted children. We've listened to the experiences of parents and children and young people in organisations such as Adoption UK to try to find ways we can increase awareness of this, and have taken action such as strengthening the guidance developed with our local authority partners to make explicit reference to the eligibility of adopted children, because I think sometimes that's not understood at the coalface. We've also listened to feedback about accessibility to the fund. Some parents have told us that local authorities are targeting spending on specific educational settings or those from a particular type of care background. And alongside these targeted approaches, local authorities are implementing universal approaches and offering whole staff training right across multiple agencies across the system, which should enhance the educational experience of children and young people and help to meet their needs in a sustainable way. But I have heard this issue raised before, and I am more than happy to go further on it if we need to. I think it's an issue at the coalface.
Yeah, I think our members would say their experience is that this funding is often very difficult to access. Now, Anna, who's one of our young ambassadors, she's had experience of having difficulties in education, so I'll hand over to her to ask the next question.
As an adopted young person, I've experienced being home educated and attending mainstream school. I know from my experience that some schools don't make adjustments to support adopted young people and children in school. Some people have to be home educated because there is no other option. There are big gaps in people's knowledge and understanding of adopted children's challenges, and in particular invisible disabilities such as FASD. What are you going to do about this?
So I think I'm going to answer. I think that comes under my bit. Well, first of all, thanks, Anna, for sharing your experience, and it's good to and really interesting to be able to hear you talk about home education. Home education is a key aspect of parental choice, and it's an equally valid choice alongside the option to send a child to school. And the Scottish Government supports the rights of parents to choose to home educate their children. But it is a right that's conditional upon parents providing an efficient education suitable to the age, ability and aptitude of the specific child. So the Scottish Government encourages local authorities and home educating parents to work together to develop trust, mutual respect and positive relationships that function in the best educational interests of the child. I think that's what's actually really, really important for home education to work, is that communication between the local authority, the education department and parents. I think it's really important, particularly for the care experience children. We've obviously, the Scottish Government's funds the care experience children and young people fund to help care experience, including adopted children in school. And I think that's important because while home education is absolutely a valid choice, we need to make sure that that's a choice that's a real choice, and that the experience in school is as positive as well, so that it's a genuine choice that a parent is making, rather than feeling there is no option other than to home educate because resources are not there. So I think that's really important, which is why it's really important that we've got that fund. I'm very clear that children and young people should learn in the environment which is best suited to their individual needs, and there's a range of provision in place in Scotland to meet the wide range of children and young people's needs, and legislation provides that flexibility for children to attend the most appropriate provision for them. I think we summarise that all in the kind of getting it right for every child, and I think one of the points that I take from your question, Anna, is that that's not always going to be the same for every child, and we need to make sure that it is genuinely not just what's right for most children, it's what's right for every child. So education authorities have a really important responsibility to make sure that they are looking at the needs of individual children. So I hope I've kind of answered the bulk of your question there, Anna, but I think key to all that is I think that communication between the parents and the education authority, and that's obviously a two-way conversation that needs to happen to make sure that whatever is decided for a child, whether it's school education or home education, it's the right experience for that child and it's supported. There's still a responsibility for education authorities even when there's home education.
If I can just come in there, I think the issue that many of our members would say is that it's not a choice. It's something that they're forced into because they're completely let down by the education system. And I think the next question is maybe a good one for that, because someone has written in saying, how can we get more accountability from schools? And this is certainly my experience. So they've pointed out that under Scots law, they're responsible for the education of their child, but as an expert on their child and as their key advocates, their responsibilities as a parent are ignored by the school, and that the school doesn't particularly feel accountable to them. So how can we get more accountability from schools so that they fulfill all their duties? And I was researching this just the other night as it happens, and you can ask for mediation, you can complain to your local authority, but it certainly seemed to me there's very few avenues to go.
So I'll pick up on that one. There's this is a common theme that I hear. So as Minister for Children and Young People, I would say this is something that is raised with me on a regular basis and right across the board. So it doesn't just affect adopted children. I hear it from parents of children with disabilities as well. Now, parents and carers, as far as I'm concerned, and as far as the government's concerned, and as far as the law is concerned, are absolutely key partners in their children's learning, and they should be fully involved along with their children. And, you know, the young people themselves should have a say. And if we think about, you know, GERFIC, which is the overarching Scottish policy, getting it right for every child, children and families should be absolutely core to that. Children exist in families, and their families are really, really important to them. So, you know, the whole approach in Scotland should be child-centred and family-centred. Caveat that, as an MSP, my caseload, I know very well that there are times when people fall through the gaps, and what we need to try to do is close those gaps. So there are a number of pieces of work going on at the moment. So if we put aside, there are, in the Additional Support for Learning Act, parents have rights, actual specific rights in law, including the right to request an assessment of need, including the right to receive advice and information. And we do fund a range of services, including Acquire, Let's Talk ASN Scotland, and My Rights, My Say. All of those offer advice and support to ensure that families can access their rights, children can access their rights. At the moment, I would say there's a real culture shift happening in Scotland. So that would be the context I would want to draw your attention to. There's a couple of things going on. We had about 10 years ago, we had the Christie report, which encouraged us to spend money early to prevent problems later on. And whilst that had some impact, it didn't have the transformative impact that we hoped for, I think most people would acknowledge. This year, in February, we had the promise delivered, so the outcome of the independent care review, and there were very strong recommendations within that about how Scotland should needed to make a commitment to specifically to care experienced children. As well as that, we have UNCRC incorporation into Scots law happening. So there's a bill going through Parliament right at this very moment, which I believe, and I know it could be my naivety and it could be because I'm quite new to politics, but I really believe that's going to help us to close the gap between what should happen, because we've got some really good legislation, we've got some really strong policy in this area, but there's still a gap on the ground that people are falling through. If we are able to shift the culture to a rights-based approach so that children and their families know what their rights are, and we have a rights-respecting approach throughout all of our public services, then that should close the gap and people shouldn't fall through it. So I think that, you know, there's hopeful issues on the horizon, and what you raised there is an issue I absolutely acknowledge, and we are trying to fix it. It's a tough one though, and I think local authorities have had a history of trying to gatekeep funding, and we need them to shift from that to looking at the child in front of them and saying, this child has a right to education, what do they need?
It's great to hear that you know, gap acknowledged, and I'm glad you mentioned funding, because what a lot of our members say to us, particularly members who've moved here from England, they will say, why not have an adoption support fund? So in England, schools can apply for, I think it's £3,000 per child, and that sends a clear message to the school, not only that adopted children need support, but there is funding that they can access to help actually not just the adopted child but other children around them. Whereas in Scotland, the experience of a lot of our members is that schools don't apply for any funding, they don't go, there's probably a lot of hoops for them to do it, and then local authorities are reluctant to give them anything.
So again, I would say I have heard that before, and that case has been made. However, in terms of the evidence, when I look at what's happening in England, I am not seeing that the problem is being solved by that extra funding being targeted. So I think that those children are still having difficulty accessing what they need. And I'm going to be controversial here. I don't think that the actual problem is about funding. It is about, the promise, the care review, really looked very closely at the human and economic costs of our care system. And what it said is there is a great deal of money going into the system. It is just perhaps not being spent in the best way. And I think, as I say, our answer to that would be to take this rights-based approach for each individual child, which, you know, it's not new work in Scotland. We've been doing this for a long time. I talked about GERFEC, that getting it right for every child approach. UNCRC incorporation will simply you know, make stronger in law those rights that are there already. But I think we need to make progress on this, and we need for the money to be spent in the right places. So we're working on it, and it's easy. In some ways, it's easy for government to say, "Well, I put this money in and I put that money in," and you know, it's outcomes we need to focus on. And I don't, hand on heart, don't believe that that has solved the challenges in England. But that's not to say it might not be some of the answer in Scotland. Being more explicit and raising awareness in schools, you know, that is a challenge that's been put to me before time and time again, that we need to, you know, that adopted children aren't, because they're often not living in poverty, and all of the other indicators that people have in their mind that might mean that that child needs a certain approach. Raising awareness of the particular needs of adopted children might be part of the answer, and funding might be part of the answer, but I don't think throwing money at it is the whole answer.
Okay, let's move on to a different area of questions that we had a lot of questions in on, and that's fetal alcohol spectrum disorder. Something I've had personal experience of as well. So I thought this was a particularly common question. So this parent says that parents of fetal alcohol spectrum disorder, FASD, share the same experience time and time again. Years of fighting for a diagnosis, support, understanding, and appropriate education. There's blaming the parents. Research shows that this goes on. FASD is the most common neurodevelopmental condition, and there's a high prevalence of FASD in adopted children. So I guess what they're asking is, you know, how can we stop this cycle, you know, continuing, even though now we're getting better, and Scotland has particularly been leading the way on knowledge and services about this, but yet it hasn't filtered through.
So I guess this is one of the areas where the areas where it's very clear that we need to work across government, which is why it's both myself and Maree are here today. So the Scottish Government's plan on FASD is set out in our alcohol framework, which is in my portfolio. Action 18 of that framework states that we will continue to prevent and reduce harm caused by alcohol consumption in pregnancy through increased awareness of the risks, increased awareness of and improved diagnosis and support for FASD. So this is one of the positive outcomes of, and this is obviously an issue that a number of parents have raised with me before, and I'm really pleased that today I'm able to announce that an e-learning module for FASD is now available on the NHS education website. That's NES website from today. So that's gone live today. So that's—
Sorry, Mr. Fitzpatrick, what's an e-learning module?
So I'll go on just to explain a little bit about what that's targeted at. It's obviously a module. I'll explain who it's targeted at in just 1 second. So the development of that resource was something the Scottish Government funded in order to provide extensive information and resources on understanding of FASD, preventing FASD, identifying FASD, and supporting families and families affected by FASD. So the module, to answer your question there, the module is going to be provided, will provide health and social care professionals, including social workers, with the skills that they need when supporting children, young people and adults who will either have a diagnosis of FASD or are being considered for a diagnosis of FASD. So we'll be continuing to work with professional bodies to ensure that module is promoted to health care workers and social workers, and hopefully that will help make the experience that people have much better, because I think one of the challenges are that for something which is, as you say, so relatively so common, particularly within that group of children, there is a lack of awareness, and awareness is not at the levels that it should be. So this will hopefully be a tool which will help make sure more of those professionals I think particularly social workers, I think there's a particular issue there, will be able to have that learning, and hopefully that will result in a better experience in the future. But it's absolutely because we've listened to the voices of many parents over a number of years that this has been developed, and hopefully it will make a difference for the future.
I think that answers my next question, which was how are we going to make sure social workers are properly trained? Although I guess that proper training would go beyond an e-learning module, but will teachers be able to access it as well?
So the learning module, if I'm wrong with this, then there's a number of Scottish Government officials who will quickly correct me. But it's online, so anyone can access it. But we're particularly encouraging. It's particularly targeted at the health workers and social workers. So it's that group of people who are really key to making sure that an individual gets the correct support. As I said, this is an area where myself and Maree and other ministers have to work together in order to make sure that we do get it right for those individual young people, and social workers are really key at that point to making sure that people get those correct connections are made.
Okay, so the next question actually is an important point, and this is how do we make sure exposure to alcohol is properly recorded in children's health records? And just to give you an idea of how important it is, so I have 2 children. One child where it was recorded in their health records seems to be fine, but that's been hugely helpful and means we've had lots of engagement with authorities about it. The other child, who seems to be affected, has no note in his health record, and we're in this endless diagnosis, taking years cycle that people talk about. So when it's recognised early by the medical profession, it can have a huge beneficial impact, 10, 20 years later.
Mm-hmm. So I think that question is probably for me. First of all, I want to echo what my colleague Jo Fitzpatrick has said about this NESS e-learning module. Many of you will know that I'm a health professional by trade, and it's normal for us to do CPD and to go to NESS for CPD. So I think that actually being hosted there, and health and social care is integrated in Scotland. It doesn't always feel that way at the coalface, but actually people are quite used to accessing the same learning from different multidisciplinary needs, and I think that's a really powerful way to get the same message across lots and lots of disciplines. So I've seen in the chat people saying, will that be highlighted with doctors and nurses? It definitely will, and it'll very, very clearly target all of the professions who need to know that. In terms of recording in children's records, this question was put to us before, and we're still trying to get to the very bottom of it. It's a pretty sensitive area. So the question over what's recorded, and there's, some people are there are some concerns about this sort of judgment or moral judgment that might be made if alcohol is recorded as an issue. The Adoption Agency Scotland regulations set out exactly what information prospective adopters can be given, and that includes written information about the child's background, parentage, health and mental and emotional development. There is a good degree of standardisation about the way the information's gathered, with adoption agencies using the same sets of forms and things for prospective parents. The way in which health information is shared with adopters varies, and often depending on the significance of those issues for a particular child. So in some ways it might depend whether the FASD is recognised early, and we know that that's not necessarily the case for a lot of the children who fall into that category. Where there are complex medical needs, it is possible to get access to more detailed records and to be walked through them. Usually that requires a meeting to discuss potential impact in advance, rather than just being given a written summary. But there will be cases where we don't know what the alcohol history is. The question I was posed before, which was around whether you could get a diagnosis of FASD if there wasn't a known alcohol history, I haven't quite got to the bottom of yet, but we're on it. Okay. So whether you can actually make the diagnosis with just a presumption, and I think we will get to the bottom of it. So that has been highlighted to us before, and we'll get to the bottom of how that diagnosis is made and whether an actual known history or whether a lack of known history can prevent FASD from being diagnosed, and how we can speed up any delay that occurs because of that lack of knowledge. Because I think there's enough evidence, seems to me there's enough evidence that of a higher rate in the group to warrant presumptions being put in, but these things take time to disentangle where the problem is.
Okay, so that brings one to the next question, which is about devoting more resources to diagnosis. And we're now in a situation where, having been on the front foot with FASD, England now is developing quality standards by NICE. So we could be in a situation where health boards in England have to follow these quality standards and have to implement them, and they jump ahead of Scotland in terms of having to provide resources for a diagnosis while we suddenly have to play catch up.
So I think I'll take that one. Obviously, NICE is a system which is in the main relevant to England. Sometimes it applies to Scotland, basically because we haven't got our own guidelines. But in this case, the Scottish Intercollegiate Guidelines Network, or SIGN, did publish guidelines on diagnosis of FASD in children in 2019. So that was actually the first time that any such guidelines were produced anywhere in the UK, and those guidelines will aid healthcare professionals in diagnosing FASD. So that the guidelines support the Scottish Government's national approach to improving outcomes and supporting the well-being of children and young people by offering the right help at the right time for the right people. The Fetal Alcohol Advisory and Support Team, FAST, is funded by the Scottish Government to deliver training locally. It's all very well having guidelines, but we need to make sure they're in practice and they're used. So that the FAST is funded by the Scottish Government to deliver training locally and nationally to improve knowledge, attitudes and confidence in professionals working with individuals with FASD. So the teams also developed FASD knowledge and support with generic services both locally and nationally to aid work on FASD prevention, identification and support in Scotland. And we're exploring how that work around best practice and sharing the learning will continue in the future and what format that might best take. In 2018, our programme for government included a commitment to increase support for families affected, for children and families affected by FASD, and as part of that we developed the FASD Hub, which was launched, and we've committed to fund Adoption UK Scotland over 3 years to carry out work to support children and families affected by FASD. So that the Hub was originally set up to support adoptive parents and carers, but it's been so successful, demand has been significant, so the Scottish Government has extended the support that we give to Adoption UK, and it's now offering its service to birth parents too. In addition, in terms of taking that all forward, so in addition to funding the e-learning resource that I mentioned earlier, we're also providing funding to the Royal College of General Practitioners to work in collaboration with the government and clinicians to produce CPD e-learning module on FASD for GPs and the wider healthcare community and primary care. So hopefully that will help make sure that those guidelines that we were ahead with actually it's important that GPs, who are often the first clinician that a parent will be able to have a discussion, are best equipped to help with that diagnosis. So that resource isn't unfortunately not able to say that resource has been published today like the other resource, but we expect that to be available next spring. So I think that's a really important development, and hopefully people will in the future find it easier to get that diagnosis, which is so crucial to getting then relevant support going forward.
Okay, we're going to have just one quick final question on FASD, and then I'm going to move on to wider issues and give Anna another chance to come in. So the last quick question about FASD is just how can we share best practice across counties and also across the UK? So I think we've all got experience of knowing someone who's had a really good experience in one area and then someone who's had a really bad experience in the other area. And, you know, the word postcode lottery is overused, but it does seem to apply in this case.
So, I mean, I guess I hope you have the impression that we're taking, you know, a multi-pronged attack at this. We don't think there's just one way of fixing this problem. We've got lots of work going on to try to increase awareness. We have got sign guidance, which was, you know, I'm a big fan of sign guidance, having contributed to it in my old life. We've really tried to improve the standard of practice in this area. And we also have so that's within Scotland. We also have lots of opportunities to work with other countries within the UK on this, and the FASD, there's a UK all-party parliamentary group on fetal alcohol spectrum disorders, and they we've worked with them. We've worked with all sorts of people all over the UK. Now, my understanding is that the NICE guidance is likely to be based very much on the sign guidance and build on it further, but we'll see what comes. I think awareness raising, working together, I mean, the systems are different. So the education system in Scotland is quite different, and the NHS is, you know, there are some significant differences, but actually the condition is exactly the same wherever it occurs. The culture in Scotland is probably one of the reasons that we're ahead of this, is probably because of our known problematic relationship with alcohol and our government's willingness to be bold in taking steps to tackle that. So I think we can lead the way in the UK. It just requires us to work using all the mechanisms at our disposal to work together and to learn from each other. You know, there are things that we are doing that are great, but there are things that other countries will be doing that are worth us picking up on. And there's really good work in Northern Ireland that we have learned from. So, you know, it's not solely a problem in Scotland, but there's a willingness and an eagerness to be bold in tackling it.
Okay, that's good to hear. Right, okay, so we're going to head over now to some wider questions in general, and I'm going to hand back to our young ambassador, Anna, who's got a question for you.
Hello. Why don't all adopted children get access to support like counselling?
So, thanks, Anna. It is a very good question. As I mentioned earlier, that adoption and the Act, the Adoption and Children Scotland Act 2007, makes certain aspects of adoption support explicit, like the provision of counselling. So if a family feels that their adopted child needs counselling, then they need to speak to the local authority, who then need to carry out an assessment and provide a support service to address any need identified. So that's a long-winded way of saying, essentially, adopted children should get access to support like counselling. That's what the law says. I think your question, implicit in your question, is the reality that many adopted children face, which is that they're not finding it easy to access that support. We have a lot of work in progress in this. So we've got a great deal of work going on about preventing and mitigating adverse childhood events, so ACEs as we call them, trauma-informed support. In the programme for government last year, we restated our commitment to ensuring that children who experience adversity and trauma will be supported by services that recognise the impact of those experiences and also support those children to build resilience. So for me, that would include access to counselling. We are investing in counselling services, you know, that there is universal access to. So we're investing I'm sorry, I'm using jargon, Anna. So we're investing in counselling services in schools that every pupil in school can access. So not just adopted children. And that's one of the cornerstones of a commitment that we made a year or two ago. We want all children, because one of the things about Scottish education is that we recognise that just as important as literacy and numeracy is well-being. You can't learn if you're not well. You literally, if you're struggling to make sense of the world. It's almost impossible to learn. So wellbeing is absolutely at the core of Scottish education, and school counsellors will be in place. I think it's later this year, actually. Joe, maybe one of the officials.
I'm not certain on the timescales.
COVID has disrupted nearly everything, the
Yeah.
timelines that we have for everything. But I think that certainly there is lots of work going on to deliver on that commitment. There's also a commitment to increase school nurses, which will be an important support for children in school with mild to moderate difficulties. And there's investment right across the workforce. So one of the things that we are aware of is that not everybody understands the impact of trauma, and not everybody takes a trauma-informed approach to dealing with children and young people. And we're pretty keen to invest right across the workforce so that wherever you go for help, if you're struggling at school, but the same would apply to any child. If you're struggling at school because of some of the experiences that you have, we want you to be able to ask and get the kind of support and help that you need, and to be able to find that easily. As I said, there's lots of work going on across the board to ensure that that can happen. But some of the specific commitments have been timelines have been disrupted by the need to respond to the global pandemic.
Someone's just made a really good point on the chat, which is asking whether the counselling will be available to people who homeschool. I don't know whether you have any detail on that.
I'd like to say yes, but if it isn't, we can make sure that, because you're still, it should be accessible to all children who need it. This is the point. It shouldn't be dependent. If we take a rights-based approach, it is what the child needs to support them rather than where they are educated that should give them access. And this is the shift that we're trying to achieve at the core. Now, I know it's really difficult because it is easier to deliver a service in if you're a local authority, it's easier to deliver a service in a school and think you've got it covered. But we want it to be about what the child needs. So I'm saying, I hope so, but I will certainly go back and check that. So thanks for highlighting it.
Even if that's not, then if it's not through that route, there should be an alternative route. Would be, I think, my point. I think it might be that, given that the aim there is to actually have those folk in schools so they're accessible, that it might need to be a different route. But I think your point's well made, which we'll both, I think, follow up.
Yeah, it's great to hear if counselling is on the way, and I know it's been a difficult 12 months for everyone, so I think everyone understands the disruption. But even before the pandemic, there were very, very long waits for children and mental health services, which now have just been disrupted even further, especially because a lot of the face-to-face assessments can't be carried out. So what is being done to try and tackle that, because that's a long-standing problem that everyone is very, very aware of?
No, you're absolutely right, and it follows on from the last question, and it's COVID has made this worse. It's probably the longest I've been in a set of conversations or questions before we've raised COVID in recent months, but this is actually one of the areas where obviously that support in terms of CAM support can't be delivered for many people in the normal way because of COVID and the various restrictions in terms of accommodation. But clearly we've seen in some areas real innovation to get services to people quicker, and particularly in Grampian, where they had some of pre-COVID, they had some of the worst CAMS waiting times, and actually they've looked at that and made a change. And while clearly some of the online work that's being done is not appropriate for everyone at all times, but it has helped reduce the waiting times. But I think your point about making sure people get children get the correct support at the right time is really crucial. So I think there'll be some lessons that we'll be able to take from COVID, which will help us from the COVID pandemic, which will help us deal with those issues going forward. One of the challenges has been recruiting the very specialist professionals into that service, and there's a shortage of people, not just across the UK, but I think probably across the world. So there's a huge effort going on to do that, but we are looking at how we can use, and NHS boards are looking at how they can use their resources differently to provide people with the correct support. It really hasn't been acceptable, the kind of levels of waiting times that have been there. And as you say, it's not all down to COVID, because in many cases that was there before that. But you know, we've gone through COVID, some changes have been made, and we're now at the point of a transition and recovery. So we've got a transition and recovery plan, which is specifically looking at how, as we hopefully come out of the pandemic, I know it won't feel like that for people in those areas which are now moving into level 4 restrictions, but we are trying to make sure that those crucial services like CAMHS are able to be better supported going forward. So there's been a specific recovery plan for mental health Scotland's transition and recovery. So that's specifically looking at how we can make sure that our CAMHS services restart across Scotland, but in a way that actually improves the experience that people who need those services. Key part of the approach is to support, is to ensure that support is available that goes wider than just the narrow NHS services, and we're establishing new community mental health and wellbeing services for 5 to 24-year-olds. There's obviously been additional funding, I think it was £15 million, to respond to children and young people's health and emotional issues, with a focus on particularly the issues brought about by COVID-19, because as well as the challenges of CAMHS services not being able to be delivered through the traditional methods because of COVID restrictions, we know that the COVID restrictions have in themselves resulted in mental health issues for many people, and obviously that includes children. So there's a range of different layers of funding that we've placed on, but I think it is a really important issue. One of the very innovative things that we've done is working with Young Scot. So we've in terms of some of their social media, and we've also spent I think it was £1 million rolling out the Stress Brief Interventions programme on a national basis for everybody over 16. But I think, you know, this is a really important issue, and it's not one that I'm able to say that we've got a magic wand that is fixing it overnight. So, but we are absolutely aware of it, and we're doing our best to try and bring those waiting times down.
I'm just conscious of the time, and I think we're sort of approaching probably the last question we have time for. So one of the things that really focuses everyone's minds, I think, is good statistics. And for the last couple of years, Adoption UK have been producing a barometer report, which outlines some interesting things. For example, the last report outlined that the policy in Scotland for various things is good, but people's experience is poor. And someone has sent in this question, which I think is a good one. So they're saying, what research into the educational outcomes for adopted young people have you collected from local authorities?
Is that one for me? So we collect information on outcomes all the time. So I suppose the point I want to respond to in this question is that gap, and I absolutely acknowledge that we are aware that that gap's there. And as I've said earlier, there are a number of ways that we are attempting to tackle that at the moment. So things like the independent care review looked at the entirety of the care system, which includes adopted children, and made some recommendations. One of the things they said is, as I think has been raised in the chat, you know, this question on whether adopted children should be presumed to have need and parents shouldn't have to battle it. They said exactly that parents should have easy access to the support that they require, not having to fight for access to the support that they require. So there's a number of, that's one strand of a solution between the what's there in legislation and what's happening on the ground. the promise has been, we are totally committed in government to delivering on that. We asked for it because we knew there were problem areas. That's why we asked for that independent root and branch care review. And we are determined to deliver on the promise, challenging though it is. What's very clever about the way they work, though, the independent care review, is that they've drawn in every aspect of the system. So local authorities have made a commitment to close the gap. All the people working in, you know, all the different charities, all the different groups that are represented in the entirety of the care system have made that commitment to deliver on the promise. Now, that's not to say it's going to be easy, because it is clearly challenging to change culture, but there is an absolute recognition that what we have at the moment is not good enough and that we need to close that gap. The other significant thing, as I said, is this UNCRC incorporation. I think all the time about it, particularly people who are struggling to access services that their children need. Sometimes that's adoptive parents, sometimes it's parents of disabled children. There is an absolute ton of legislation there. There is excellent policy. We lead the world in some ways in our, you know, like getting it right for every child is world leading. That is not stopping some children falling through the net. And the shift that will come with UNCRC incorporation, it will require a shift in culture, so approach on the ground. It will mean that people don't have to fight to find out their rights. They will be aware of their rights, and there will be support. And crucially, it won't necessarily fall, so there's justiciability, which again, it's a big word. It means that there will be able to be legal action to ensure that the law and the policy happens on the ground, and when it doesn't happen, there can be legal consequences. Now, we don't want there to be a whole lot of legal cases, obviously.
Nor do we.
I don't think anyone does.
No.
But we have made it, we've simplified this. So one of the commitments in that piece of legislation is that there can be, you know, cases can be taken by the Children's Commissioner where he sees there's a systematic problem. So it shouldn't have to fall, the burden shouldn't fall on parents to sort the system for everyone else. So we're really trying. As I say, I am hopeful, but this is such a significant constitutional shift. It really is. It shifts the power into the courts, frankly. So it is massive. And I think it could be hugely transformational. But I tell you, if it doesn't work, we'll just go and find another approach, because we're determined to fix that. It's not that we don't acknowledge that there's a problem. It's just, you know, when, as everybody says, there's good legislation in place and there's good policy in place. So why is it not happening?
Well, I think we'd all love to see Scotland lead the way on this, and I think we're out of time now. If you see the little clock behind me there on my shelves, we're out of time. So I'd just like to thank you both, Maree, Todd and Joe Fitzpatrick, for joining us, and thanks to everyone for such brilliant questions. I'm trying to keep an eye on the chat, but there's a lot going on, but I hope I managed to feed in some of your comments there. And I'll just hand over to Robin, who has a few final words.
Yeah, really just for me to say thank you to everyone who's been involved in the event, and just a little bit about the next step. Thank you, Eleanor, for agreeing to host and for keeping things flowing so effortlessly. That's been brilliant. Particular thanks to Joe Fitzpatrick and me, Todd. I think a lot of people who are attending today are very, very busy, but you have to imagine that ministerial diaries are under pretty much unprecedented pressure in the midst of everything that's going on at the moment. So it's been really helpful just in terms of having that commitment from the demonstration of a commitment from the Scottish Government to the importance of adoption for some children, and willingness to come along and share your thoughts about some of the really difficult issues that people are grappling with, who've adopted and who are supporting people who've adopted. Thanks to everyone who's come along and asked questions. Sorry if your question didn't get asked. We actually had enough questions to keep going for the whole day, so some of them were grouped. So you may, hopefully, the spirit of your question was asked, even if the letter of it wasn't. Particular thanks to Anna for being brave enough to put herself forward and to ask a question in front of a whole pile of people online. So that was particularly excellent. In terms of next steps, the kind of key messages from today's event and from all the other Adoption Week Scotland events will be on the adoption.scot website, so keep on having a look at that. More generally, Todd's mentioned the promise a couple of times, and I think that is a really genuine opportunity to address some of the fundamental issues for all children who've been care experienced. And I think it's important for everybody who's been part of today's event to be thinking about how can we make sure that the sort of issues that have been discussed today can be part of the debate and part of the transformation that's offered through the work of the promise. So thank you very much for coming along. Enjoy the rest of your day. That's been really positive. And if you're coming to any of the final Adoption Week events, hope you enjoy those as well. Thank you.
Thank you. Bye.
Bye.
Thank you.
Bye.
Thank you so much.
Really lovely to be with you to celebrate Adoption Week again, and thanks Anna for asking the questions. You were fab. Maybe next year we'll all gather again.
No, it would be lovely to see you in person again, but thank you so much.
Indeed. Thank you. Take care.
Thanks very much from me.
Thank you.
Bye.
Bye.
Thanks.